Northwest, very worrying today. The nearest clinic is about a 45-minute walk, and the nearest hospital is over an hour's drive. Last week, eNCA told the story, and today, Health MEC Madoda Sambatha is there. Masego Rachlacha is monitoring developments. Let's go live to her now. Masego, hello to you. Give us a sense of how it is that eNCA broadcasts the story last week, and suddenly we have officials on the ground.
Well, Gareth, that's also the question that I asked myself. As you can see, there are, healthcare workers who are going around homes here in Mapaputle to make sure that people are screened, for instance, for COVID-19, but I think as well as, other issues, health issues that people might have or health questions that people might have. As you know, the community did tell us last week that they do have a mobile clinic that is supposed to arrive here on Mondays. Some of them say it's not really consistent. But I do have the Health MEC of the Northwest with me, Gareth. His name is Madoda Sambatha. Thank you very much, MEC, for joining us. You're live on eNCA. I just wanted to know your visit here today. What prompted your visit to Mapaputle today?
Our visit here today, it's on the basis that last week there was a play by eNCA from this community. And the community said they've been looking for government for 9 years. I came here because there can never be a community in our province that has no access to the Department of Health, at least while some MEC. Department shall be accessed permanently on each day. That's the reason we're here. We're showing them that it can't be 9 years. We are government, and we know them first as residents, secondly as people of our province. We also know their contribution economically as an area. So the reason is purely to get screening to them, whilst we also get to understand what are the deeper issues that are challenging them on a daily basis, health delivery and government delivery, because on government, one MEC in one area must take all the concerns of that community and then distribute them accordingly to relevant MECs. As I'm here already, the issue is health services and roads. Even where there are clinics, the problem is accessibility because of roads. As of today, I said to them, I'll take them. Next time I'm coming here before the end of the year, I'm coming with an MEC of public works and roads. But as I have came here, it's for health. And already I have taken decision on matters of health that pertains to the community.
Can you just take us into your confidence, MEC, in terms of what it is? I'll give you context, MEC. We were here in this community last year before elections. We came back actually more than a year later, and the community is complaining about the same frustrations when it comes to your department. The clinic that they go to, for instance, in Mogoditsani, closes on weekends. What do you say to that?
This is a ward of 9 villages, with a population of 7,000 combined in 9 villages. What I've already told them as a decision is that the ward councillor, the municipality of Moses Kotane, and the sub-district of health must have a meeting of health delivery planning where they must map the ward and check where are the current 4 clinics situated, so that we then come to a decision as to whether the 4 are accessible to the 7,000. If not, which one should we shift around so that at least coverage must be for the rest of the population. Then from that, we'll have 2 24-hour services that have access to both sides. We're also going to increase the EMS availability on the basis that Mutlabe Clinic is 24 hours. We're going to advertise for positions of EMS so that we increase the number. Whilst we are looking to health planning, We deliver services, not people subjected to non-availability of services. The mobile clinic is going to come once a week. It was coming twice.
So are you admitting, MEC, to us that you have indeed forgotten the community of Mapaputle in the last 9 years?
No, they have never been forgotten.
But how, MEC, when they themselves are saying they've been asking for help for the past 9 years in your department? They say that they vote for the ANC every single time that they need to vote. But when you look at this community, do you think the ANC deserves those votes?
Let's deal with Mapaputle in context. This is a population of 500 people. As to who they vote for service delivery, it's not an issue. It's communities in our province, registered voters in our province, whether they vote for ANC or not, on giving delivery of services, they deserve to be getting service delivery.
Have you been giving them enough service delivery?
Here is the fact, 500, they don't qualify for a clinic if you go to the law. They are serviced by a mobile clinic. The problem that I've changed today is that this mobile clinic was coming here twice a month. Now it must come once a week. Secondly, they are going to have planned patient transport in case there's a person who needs health services beyond the 8 hours. Thirdly, with effect from the 8th of June, in the rest of the province, 407 municipal wards will have 10 community workers, 1 professional nurse in that list. Each ward will have its 10 with 1 professional nurse. They will be deployed permanently to a ward. They shall be screening for health delivery across the board on daily basis. They shall also ensure delivery of medication of our people door to door.
Thank you so much for your time, MEC. That's very good news to hear. And as you heard it yourselves on eNCA, the MEC comes here after our report last week to just make sure that at least in his department everything's going well. But he promises also that he'll speak to his counterparts in other departments, including roads and transport, for instance, to fix some of the issues here in the Mapaputle village.
Thank you very much indeed. Saw the story on eNCA there today, and no doubt our team are going to make sure that what the MEC has just spoken about is indeed going to be taking place.